So here is the biggest mistake that I see aspiring medical writers make. Usually people will come to me and say something like, I've been applying for so many medical writer roles, but nobody's paying attention to me. Can you just give me some tips to help me break into this profession? And the very next question I ask them is that, well, what kind of medical writing are you trying to get into? And usually people will look at me, or people will pause in the messages and say, huh? Like, what are you talking about? And therein lies the biggest problem. There are different types of medical writing routes, maybe let's call it that you could go on. All right. And it's really important that you understand what the function of each of these is. Now, for instance, if you are a medical writer who works in a regulatory or clinical research, all right, your work is going to be around drugs, drug approvals, and understanding the clinical research cycle. If you don't demonstrate that on your resume, I'm telling you right now, having been on the other side, having gotten to be, I'm not a hiring manager, but be on the other side of the hiring decisions and being able to weigh in. If you come not understanding what clinical research is, not understanding what the drug approval or drug testing cycle is for the pharmaceutical industry, it's going to be really, really hard for anybody to pick up your resume and say they want to hire you. The same thing goes for marketing. I personally work as a medical writer in a marketing/technical role. And these can be actually two separate things, being a marketing writer and being a technical writer. I just have this unique, position in my case. Again, if you are a medical writer with a scientific background going into a marketing role, that's also really different. In this space, you'll need to understand, the buyer's journey. You may need to understand why we need an application note or the purpose that a white paper serves in the market. You really have to understand that. And very often you're going to be in meetings where they're talking about launch strategies and go-to-market strategies and all kinds of strategies, okay? And you have to at least have some understanding of that. And again, if that's where you want to go, you absolutely need to demonstrate that through your resume. Then you have technical writing. These people, like the name suggests, are very technical and are going to be those writers that are maybe involved in writing manuals and very technical documents that go out there to customers. You also have health journalism/health blogging. And a lot of the time I see a lot of nurses, especially hello nurses, a lot of nurses going into this space of writing health-based articles. And so think of the WebMDs of the world, think of the Healthlines of the world. They need writers with your type of scientific and medical understanding to write for them. And so you could also operate in that space. Then you're going to have your writers who write in the education space. And so these people also do a different type of work. So what's the point I'm trying to make? The point I'm trying to make is that when you type in medical writer and you start shooting your resume everywhere, assuming that people should understand that because maybe you have a PhD or PharmD or MD or you're a nurse or something, that you're so smart and therefore they should hire you, I am here to tell you that you will be sorely disappointed. It's really, really important for you to understand the type of medical writing role you are applying to. And then once you understand that, it's really important for you to show on your resume. Now, for those of you fellow PhDs who very, very academic and you publish a lot of papers, right? Hello to you. Your papers that you published in academia, while those are great, it's not always the type of writing that they're looking for. Yes, so if you're an academic and you've published all these papers, don't just automatically assume that hiring manager should intuitively know that you know how to write. Sometimes those hiring managers do not really care. Not even sometimes, a lot of the time, they don't really care about your publications. They care that you can write the types of documents that they need. Can you write a clinical study report? Do you understand what a protocol is? Do you understand what an application note is? Do you understand? Like, you have to demonstrate this understanding on your resume, right? Even if you're new to it. And there's a video that I did with Dr. Vera Chan. I will link it in the cards above. You can go watch that on how she broke specifically into regulatory writing. And so if you want to read a little bit more into that, I have a blog post on my website. I'm going to link it below. Go there and I list 30 different tasks of a medical writer. And I do break them down by the type of medical writing. So yes, go check that out. And you know, if you're looking for the next video to watch this one here, or maybe it's here, that I did with Vera Chan on how she broke into regulatory writing as a newbie, as a beginner.